I would like to celebrate everyone's children's Independence Day of Turkey, and I would like to express my gratitude to the organizers of this conference. Every uh, possibilities means and hospitality of the hotel is so good. Our topic is etiology and treatment in autism spectrum disorder. Let me talk about this. Its name is autism spectrum disorder. Its frequency of being seen in the society is about 1.5 to 2.5%. And when we talk with Professor Elvan in 2001 and early in 1990, it was rare, but nowadays it is not rare. One thing that is seen once out of 40,000 is also seen in your close relatives or in your family. The physicians should be knowledgeable enough about this when they intervene early. It dramatically changes the results positively for the family and the patient. And it was recently called as intellectual development disorder. This is AGB. MR see encounter 3 times more than the autism. They overlap actually. Mental retardation in autism is 50 to 60%. In 1990, it was 80%, and this actually uh, signifies to changes in classification. This was reduced through those changes in the classification. I asked the question to Ali Tatar yesterday. Along with autism, there must be absolutely psychiatric and medical conditions in the patient. In 2010, Gilbert defined them as essence, and these are early symptomatic syndromes eliciting neurodevelopment clinical examinations. I wish this definition was more precise and shorter. And autism is not 100%, but in monozygotes, this essence is 100%. And the sibling of autism, monozygote essence accompanies autism, and uh, 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 after autism relapses and recovers, essence continues to survive. How did they define it? Epilepsy, motor control difficulties, anxiety, sleep disorders, depression, and these problems. And intolerance or difficulties in digestion, um, and some part of essence is psychiatric and the other part is non-psychiatric. And the first of the long tables. I do not want to delve into many details, just want to give a brief summary during the time frame. Firstly, Forstheim and Rutter showed its genetic aspect through epidemiologic studies, and as a result of these studies in 1980, the ancestor of the CM that we use are the cluster of common spread developmental disorders emerged, and it consolidated to autism spectrum disorder, only one disorder. This heritability is a factor during the time frame. This concordance monozygote zygote is involved in it. The maximum concordance is between 0 and 94, and as a summary, in monozygotes, this is the level of the concordance, and the size of these circles actually uh, reflect the size of the sample. The heritability is maximum 93% and minimum 26%. Finally, 50. Recently, it was 50%, and the data published in 2000s are very strong. The monozygous dizygous concordance accompanies it, and in 2014 study, Sant and et al. Collected a sample of over 14,000 based on community spectrum disorder group. There is a very high risk factor in autism. The visigoting reduces almost 20 times. Uh, this is a data showing the importance of genetic aspect. Um, in dizygotes, the risk is 8, but in real sibling, it is different. It is 10.3 for sibling from the same mother. It is 3.3 for the sibling from the same father. It is 2.9. It means that the genes coming from the mother is more influential. The genetic architecture in the girls and the males are different than the siblings from the same mother involve carry higher risk. In the beginning of the 2000s, being a cousin relative did not constitute any risk. It was the common belief. Being a cousin is a third degree relative, and this is 2.0 risk. For the cousin, the risk is 2.0. So being a cousin is also a risk factor. Comparing to the monozygote and the real sibling, biological sibling, of course, it is lower. And we have a long and detailed graphic regarding the autism, how the genetical processes continued. We see all these aspects in this graphic. This is the DSM-3 period. This is the ancestor of the DSM that we use, DSM-3R, DSM-4, etc. after 2003. And for the first time, genetic component was discovered in 1980s, and in the chromosome investigation, Gilbert discovered the existence of chromosome abnormalities, and then regarding the neurofibromatosis, the genes started to emerge gradually. The distorted genes were discovered in the autism group gradually, and the ones in blue color are those which show the prevalence, and the prevalence increased gradually. And finally, we see 1.5% at the beginning of 2010s, and in the genes which are shown to be distorted in autism was discovered in the years as highlighted by red line, and also there is a gene pool where the autistic these individuals are collected. While this was 3 or 5 in 1990s, in 2010 it's increased to 700. These are the genes distorted by autism since the 1970s. There is karyotype. There is also the Human Genome Project started in and completed around 2005. While we were assuming that we had 100,000 genes, it was discovered that we had only 40,000 genes. The human genome was defined, and the defined genes increase rapidly, and the microgenes chromosome microarray analysis was made. I will be mentioning about whole exome sequencing and whole genome sequencing, and there is also the copy nums. They play significant roles in autism. Copy number variants, the final chromosome arrays, actually can show them until up until 50 kilobats, and also the whole exome includes less than 2% of the human genome. Whole exome sequencing is very interesting, and it is promising. And whole exome, as you know, the exomes are uh, the parts entering the transcription, and the whole of this embryo is lesser than the 2% of the human genome. Just we don't have millions of data about them compared to the whole genome sequencing. However, they contain 85% of the known disease maker genetic variants. So far, until the beginning of 2020, the first inspection was microarray, but the whole exome sequencing was first sequencing. For example, there's also triple sequencing, including the father's exome, mother's exome, siblings exome, and the infected person's exome, etc. In this way, we are able to see which parts are inherited and which parts are distorted. So, chromosome microarray shows precise pathogenic CNVs at the ratio of 10%, and there are also not fully determined CNVs. And regarding the whole exome sequencing, there's a study published by India, and in the copy number was about 3%, but in whole genomic sequencing it was more precise, and it turned out that WES was better than CMI, and they suggest WES as the first step genomic examination. This is very promising in the future, and if all the patients have a genetic profile, the database available to us will also expand, and our accumulation of knowledge will increase, because how we recognize our relatives that we do not know even, we just recognize them by looking to their photos shown by our own families. Without an album, how are we going to know our relatives? This can be assimilated to this, and if every patient have a genetic profile, we will be able to recognize them, and our genetic accumulation of genetic knowledge will increase and expand. And well, what about these common spread, general and rare um, variant genes? Oh, the autism derives from the interaction between the common genes and the rare genes. Defining the rare variants is much easier. It can be assembled to the tsunami, and several genes coming together may create very destructive impact, but the common variants exist also in us. We are not autistic, but those common variants defect exist in us also. But these are tiny ways. 5 or 10 or 20 of them come together, creating special color, feature, and also uh, if there is a vulnerability with the FMR engine, a full spectrum may emerge. The role played by common variants is much more distinctive for autism, but there is no autism related common variants available to us currently. Let me speak about them also. It is a little bit complicated in terms of its way of being explained, and this is the diagram of the genetic and environmental factors. This is the genetic factors, then accountable for 62%, and here are the environmental factors, the blue circle, 38%, and in the middle we have the de novo varieties. These are genetic, but these are not heritable. The heritability is shown by green color, and 49%, and those emerge during the pregnancy due to accidents or unfortunate events, etc. And these are manifested in the examples. For example, the when the destructive central emerges, it causes autism. Yellow is 2.6% rare variance. Apart from the genetic factors, we can also define them. As I said, when there is any distortion in one or two genes, it directly causes autism. I will be mentioning about it without further ado, relating the shunts and shunt proteins, because they are very specific to autism and schizophrenia. But the green part is the most problematic part for us. We have very limited information about the green part, about the common variants, and they exist in us also. And this is the main part which causes autism. And I will be talking about also regarding any reference human standard genome sequencing. When you compare, there are genetic sequencing difference more than 2 million variants. Most of them are found in single monomorphic and single nucleotide polymorphism, and 95% of them are common variants. It exists more than 95% of the human being. No common variant were shown to be related to autism so far. And as we know the genetic profile of the patients, we will be able to know the special combinations. We will be able to say that this gene is related to autism when these and these situations exist. These are the genes which doesn't make any sense alone, and the environmental factors in the blue circle, these are the epigenetics. These influence the synapses. These are not inherited. The most important factors is the they are accepted as the main risk factors. If in the gestational periods, if there is excessive activity, this is very related to autism. Most probably excessive immune activation is significant for the is a significant illness making factor, and the genes shown to be destructed with autism, they just come to the same point in certain pathways, and those pathways may be directly related to synapse, and they may also be related to uh, uh, actin dynamics. It just doesn't matter. The result is that synapse is disrupted in autism, especially causing synapse homeostasis. We will be hearing this statement more frequently in the upcoming years. If it affects not only synapse but also these areas, autism is called as profound autism, severe autism, and syndromic autism. It manifests more destructive impacts, and also if synapse homeostasis is discovered, we will be able to better understand schizophrenia, because the disrupted system are similar in both, and also the proteins, the related pathways are uh, examined, and the neuron and synapse development action guidelines, signal pathways, FMRP targets. I will be mentioning all about them. All these are disrupted. Synaptic homeostasis affects certain parts, and distortion happens in long synapses, especially in the prefrontal system. There is underconnectivity. The insufficiency criteria exists in DCM5. The brain detects it in the early period, and maladaptive plasticity occurs in certain parts of the brain are activated excessively. There is overconnectivity. For example, the perceptual cortex, amygdala, striatum, and after they perceive insufficient connectivity, they become overly active, and leading to criteria B, which are the undesired situations. What about the uh, genetics, the genomics? The I will be using the metaphor of an aircraft. For example, we are trying to create an war aircraft. This can be, genomics is just a blueprint of that aircraft, and transcriptomics is the version of the aircraft which was produced by the factory, and the things conducted by the pilot during the land off, during the landing to the sky and landing down. These are different actions. These are the proteomics, protein and proteomics part. These are the things performed by the pilot during the flight. Uh, if the pilot do not push a certain button, or the pilot doesn't do critical things, the flight will not be possible. So protein and proteomics part is the main dynamic part, and the networks regarding the interneuron and stans are down-regulated. They are not enough regulated, and the networks in immunity are upregulated. They are excessively active. As we know, in schizophrenia, there due to an excessive immune response, there is excessive chopping of life. Ne- NMD receptors pose a risk for schizophrenia. The overly activated immunity disrupts them, and this creates a syndrome. We call it as schizophrenia. This is a disrupted system. This is an overly activated immunity, both brain immunity and general body immunity is overly activated, and brain becomes a target. For example, in psychosis, in autism, sorry, um, the lifelong risk is 10%. For bipolar disorder, it is 5%. So there is such a risk also. The individual is also autism spectrum, has autism spectrum disorder, and after a certain age, the individual also develops other disorders accompanying it. The most part of the brain which is distorted are the frontal and temporal cortex. the immune pathways become excessively, overly active. What is the importance of the X chromosome? Well, all chromosomes are equal except for Y, but other chromosomes are more equal. This is also valid for the chromosome X. Chromosome X is the chromosome which involves the most number of the genes regarding the cognition and brain development, and this is very special, especially for the synapse development. In males it is one, and in the girls it is two. Maybe in the girls it is seen 4 times less frequently than the males. And and also it is the X chromosome which is mostly impacted in the combination of opium sacrum disordrum and AGB. The dominancy of estrogen in the girls prevents the uh, a, uh, severity of the disorder, but only when the girls with autism spectrum disorder get ill, they get more they get sicker than the males having autism spectrum disorder. This is the synapses. The structure of the synapses is much more complicated than we assumed. The most complicated synapses are frontal temporal synapse. In autisms, they are specifically distorted. In synapse structure, most of the expressed genes have been identified, and the number of the total expressed genes is about 2000. This is the human synapse pathway. In about 2000 synapses, there are expressed proteins, and when we look to the synapses, this presynaptic part, well, the presynaptic part is much more simple. This functions as a much more mechanical part, and there are physicals. They get empty, they are loaded. There is much more physical activity, but this postsynaptic part functions much as an electronical system. It is much complicated. There are receptors, there are radar systems, and what makes these complicated is that they have certain assembly platforms for the settlements of the receptors. There are the systems which ensure it, and the settlement of the receptors and the healthy functioning of them is enabled by it, and the metabolism also must be strong enough. As you may predict, the most affected part are the postsynaptic density. Here, there are a lot of molecules. I do not want to give rise to confusion. Postsynaptic supramolecular complexes, I will be giving example of. These structures are the most complicated protein structures. They have million Dalton's molecule weights, and the first of them are mass complex. They are called as mass complex. This they include abbreviation of the abbreviation membrane related guanylatkilase related signal complexes. This is the whole of this structure, and of course it is this in all the vertebrates, and they have a port-like structure, although its name is kinesis, they lose their enzymatic activities and they can be resembled to the rough construction of a building, of an architect. The architecture of the building must be healthier, strong enough so that the electricity, water installations must be built on it. And also, it consists of 473 proteins. This is a very large structure. It is weighter than 2 millidalters, and this is the main part of the Lego. And if you are trying to build a car out of Lego, this is the part of the Lego which is the body of the car. 30% of it is directly related to SSS disorders, brain disorders, in the psychological disorders, which it is mostly related to, is bipolar and schizophrenia. Mass complex schizophrenia disorder cannot be encountered in all the autism disorders, but in all the mass complex disorders, these disorders are encountered. These are very specific issues. This is a very important scaffolding. There is also
And these shank proteins are also very much important scaffolding proteins. It has a triangle like the shank 1, shank 2, and shank 3, and both of them are related to autism. And so it is a scaffolding. So let's say it's a scaffold. It's a scaffolding protein indeed. And there is Phelan-McDermid syndrome is also associated with it, and it is indicated with delayed linguistic development, EGB, and MR and hypotony minor, craniofacial dysmorphism, and also the lessened response to the pain, epilepsy, or USB as well, and it also helps the so it is shank proteins. And also in regard to that, another this is shank protein, as you can see here on the lower side. It is anti-actin base, is cytoskeleton is the connection tissue, and there are these section here, and then from the postsynaptic density, it leads to postsynaptic interval, and also it. It is also on the Schenck homeostasis. It is an important modulator for the FMRP as well. And if, you know about the fragility, and FMRP on this level, there are repetition of the CCG repetition, and it is and the protein does not produce any output. Instead of 10 it on, or is instead of 10 it produces only three products, and the researchers cannot find it is targeting protein. And however, they say that the MRA is around 3 or 4% of the brain MRA. Actually, it is a regulator for the protein development. So it's a second kick actually. If there is any secondary vulnerability, so it also makes the syndrome much more visible and much more apparent. And so it can be 20 it can be 20 repetition of the phenotype. So in the grandfather, or it is 40 repetition in the father, or 120 repetition for the sibling, and sorry, for the offspring. And actually it's a Velcro tape, and so and actually it is the first conduction of the neurosynaptic and synaptic adhesion. So if in lack of this, so we synaptic structure cannot be established in absence of this. And so after the synapse plasticity, it is responsible for this plasticity, as well for the maturation and elaboration as well. And it also provides the whether it is the exhibitor or inhibitor, whether it will be vivid or not, and whether the synapse will be alive or not, it will be supported or whether it will be elaborated or not. All decisions are taken by this decision, and so it is very long name as you see here. It is so these are the one is the interleukin 1 receptor for the presynaptic and for the postsynaptic side, and it is protein tyrosine phosphatase, and these are all very specific for the autism, schizophrenia, and also however, it is really very much related for the major psychiatric disorders like the ESD, schizophrenia, and EDD as well. And so it is completely related to the prognosis because it also uh, it it may be also leading to a delay in the puberty, or also it may lead to some also dyslexia and other learning difficulties as well. And here it may also lead to deterioration of the global mRNA translation balance, and it may also lead to actually deteriorate the structure and the function of the synapse as well. And you can consider as the work order or the work tracks that transmits the work orders to the cells, and so it may lead to some severe autism as well. And so as we know that the target of the FMRP is the mRNA, and so if the protein production is limited, it may deteriorate all the, and it is also an important important regulator for the translation. And so of course its conclusions are really so much important to me because these are the like syndromic autism, epilepsy, autism, and when they check on this gen profile, and they have labeled the affected genes here, and as you can see, and for the synapse cases, when there is a mild autism for the synapse deteriorated structure, and autism plus syndrome for the moderate ones, and I have talked about this part. I will not be so. I have also covered this part as well, and this is one of the first detected ubiquitin proteasome system, and related to the AMPA here, and so AMPA receptor of the glutamate on this part, and it is responsible for the turnover part, and because these are one of the basic elements that affect the long-term potence and learning, and it leads to mental retardation plus autism, and especially it is associated with the mental retardation because in absence it cannot be turn into long-term learning, or so there may be problems in recalling and remembering, and I have covered all this part as well. And so it's just a summary. And so, of course, as I told you before, the synaptic hemostasis is impaired in ESDs, and in the many synapse-specific negativities occur. Glutamatergic, GABAergic, and cholinergic neurotransmission is impaired, and the identity maturation and collaboration of the synapse is disrupted, neurogenesis is impaired, ion conduction is also impaired, and structural and functional scaffolding molecules are also impaired, as I told you before. And so in 2021 in Eskişehir, during when we explained in the faculty of education, and they have said that you have covered it and you have resolved it and you will be managing it, right? And so so we look like a child, 6-year-old child, taken to the plane museum by his father, and actually we are just a toddler. We are just a toddler on this specific area, and so there are many. I think in our near future. And so we have to measure the synaptic hemostasis, and there should be and quantitative and the material measurement should be available, and I think so we need to discover them in more detail. Yes, we have synapse genome, we can also reach to synapse transcriptome, and however we don't know about the synapse proteome or synapse metabolome at the moment yet. And so there are some also induced product and stem cell, like for example they get actually chin epithelia, and in several weeks, and they changed into neuron and glia cells in cells, and then these glia cell they can be replicated in vitro cases. And of course it is very challenging to differentiate the neurons at the moment. And yes, there are neuron and glial cells are produced in as a in vitro cases, and but of course it is really so difficult to perform in vitro cases on the table at the moment. And however, especially multi-electrode and human neural microcircuits, multi-electrode electrode arrays, and electrical activity measurement and network simulation and connection analysis could be possible, have recently been possible. And from especially for the piliopatal cell, if we can identify it in the piliopatal cells, then it will be possible in the future. But what do we have today? And so we don't have anti-autistic treatment in our country, and so we are using antipsychotics. And however, they cannot treat the spectrum of the autism in most cases, and so we benefit from uh, we've benefit, especially as we know that the comorbidity rate is around 70-80% in autism, and like the ADHD, disruptive conductive disorders, anxiety disorders, OCD, and the mood disorders are the comorbid conditions. And there is no medication that cures the core symptoms of the ASD, and there are very rare head-to-head comparison of the aripiprazole or risperidone in ASD. And so I have seen only two studies that compares aripiprazole and risperidone, and it was around 5.5 milligram per day, and there was no difference after two months of a period. And actually I didn't write the age group here, but you can reach this study. And there's another study in 2019 and 12 weeks of study. And so in the third, up to third week and the sixth weeks, the aripiprazole is better. However, in the others, the risperidone is also better. And so they for the aripiprazole, they use from 2 to 15 milligram and risperidone from 0.5 to 3 milligram. And of course, the timeline is different here. And so, as the aripiprazole has an antihistaminic effect as well, so it may also lessen, it may create some also alertness issues as well. And in regard to aripiprazole, and so risperidone is a more straightforward drug, and it is much more efficient for the smaller age group. And when you combine it with the stimulants, and they do not eliminate their efficacies. And however, it may also it may increase it may increase it may be much more suitable to select the night doses. And for the older age group, and especially for the 8 to 10 years, I prefer using the aripiprazole, especially. And also prolactin, high level of the if the patient is symptomatic, they were saying that you shouldn't there is no need for looking about this prolactin high levels. And however, prolactin elevation shouldn't be tolerated even it is asymptomatic. And there are some studies, and I think in 2016 with the and the young adults, and 80% males. And as you and so high level of osteoporosis and osteopenia were indicated on these people, and as a secondary and anti and actually the antipsychotic exposure rate is very around 12 years in these patients. And so we only ariprazole should be added as a. And so there are others, and actually we don't have enough actually efficacy evidence is insufficient regarding efficacy of the safety. Olazapine, quetiapine, ziprotapine, lorazepam, clozapine as well. And maybe when we especially use lorazepam, there is no liquid form. It's a handicap for the patients. It only has tablet form, and it may limit and also lithium while brought, and so are effective in irritability in the ASD. However, they are not effective as the other as psychotics. And so in our and there is an ariprazole is in the first rank with a 32%, represidone especially 20%, and quatapine also in the three most commonly prescribed atypical APs. And actually so we are using only 10% 10% of our phones for the phoning purposes. We are saying that it is antipsychotic, and however for the non-psychosis purposes use is much more prevalent for the for many areas. and actually we are using it in so and for the antipsychotic treatment, unfortunately we don't have uh, so Manisa team has mentioned, and they have seen that. And these are the doses that we use for the risperidone, especially for the autism. and there is no need for going more than 3 milligram per day. And so, and of course there may be cases where it is required, and however aripiprazole actually so it is underdosed actually like the risperidone. So from 0.5 to 1 milligram aripiprazole is also common, but I suggest that 2 milligram should be the starting dose, and it can be increased to up to 10 to 15 milligram per doses. And I prefer single doses per day to refrain from the acatezi. And actually, so for the atypic AP usage for the ASD, and especially when you start use of significant relation between the antipsychotic use and the seizure development independent of the psychiatric diagnosis, if started within the last 90 days, and if used more than 90 days, then actually for the seizure it increases, and the risk not significant from the past use. And however, the risk increases with the multiple AAP usage, and all the second generation AAP use associated with the increased seizure risk. And and autism is very much misused diagnosis actually is by the psychologists and psychiatrists and the others, and the family is taken to is trapped, and they will be always saying that so, and you are they are just injecting the supplements. They are just using supplements without any clear deficiency, and therefore our objective is to save the families from these traps. And what are the contribution of this? Uh, what is the contribution of this genetic etiological diagnosis examination to this ASD and autism, and especially it can increase the accuracy of the genetic counseling provided to patients and families, and it may also provide benefits regarding the prognosis and expected clinical course in the future, and it may also indicate the risk of recurrence within the family, and of course it may be cardiac issues and also early term cataract. It may be an precursors for them, and it may help identification problems that may arise later, and it may help us to see family album of the patient, and so it will also accumulate our knowledge on the patient, and then it can contribute to improving the treatment opportunities. And of course some of them they may be ultra metabolism cases. There may be very small metabolism issues can be and so for example cannabinoids, CBD oil, and some other just penetrative issues, and so the cost benefit and cost benefit issues are really much uh, in turmoil, and also it is very much in dilemma, and it may also help developing services we need and developing treatment protocols that can be enabled for the creation of the new methodologies. And this is the very last slide, last but not least, and also it may we may request pediatric genetic consultation, and we have said and they have started there are many patients, as you know, for other psychiatric diseases and neurological disorders with a three generation family tree, and the patients may not be, and they say that you have to get the you have they say that you need to get this appointment from the system they say, and also dysmorphology and physical examination, skin examination, and growth parameters should be checked. And if there is a suspicion of the specific syndrome or metabolic disease, consult the relevant department. And also, they will be asking about the sequencing, and especially fragile leaks, and MGB2 for the girls especially. Thank you very much. That was all from my side.